Okay, thanks everybody for coming. We're very lucky today to have Dr. Kirsten Beyer here with us. And Dr. Beyer is a professor in the Division of Epi and Social Sciences in the Institute for Health and Humanity at Medical College of Wisconsin. She is director of the PhD program in Public and Community Health, co-director of Global Health Scholarly Concentration for Medical Students, and co-directs the Geospatial Epi and Outcome Shared Resource of the Cancer Center. So she holds an adjunct faculty appointment as well in geography at the University of Wisconsin-Milwaukee. So quite a varied background. Very busy, aren't you?
I don't like to be bored.
Yeah. Dr. Beyer received her PhD in geography and her MPH in global health from the University of Iowa. And she focuses on the intersection of health, place, and societal and environmental justice. She seeks to identify environmental and systemic causes of health disparities and to apply community-engaged research framework in doing that. So works a lot on neighborhood characteristics such as green space, racial segregation, redlining and housing, and looking for other community-driven solutions. She also partners with research groups across the country to look at influences of structural racism on a range of health outcomes using very large cohort study databases. She's been funded by NIH, Environmental Protection Agency, American Cancer Society, American Heart Association, and the National Science Foundation. So we're very glad you're here. So we're very glad you're here, and we're looking forward to your talk.
Thank you so much. Maybe you and I are familiar with what's going on at the NSF right now. My whole study section got fired, so it'll be an interesting road forward. But thank you for the introduction, and thank you for welcoming me. Thank you for the invitation. I'm excited to be here. I'm going to share with you, try to share with you a number of the different things I do, but stay focused on one major topic, which is structural racism in housing and then health outcomes in the United States. For those in the room who do global health work, I also do quite a bit of that, but you won't see a lot of it here, but I'm excited to talk to you about that as well. Click. Uh-oh. You said the big word.
There you go.
Thank you.
Maybe. Can I try?
Yeah. If it works, see, that's not fair. All right, now I can do it. All right. So just to orient everybody to my background, since there's not enough time to talk about all the things any of us do in 1 hour, I just wanted to share a little bit of sort of the overarching sense of what I do. So non-communicable diseases, I would say, is my main disease area of focus. A lot of the work that I've done has focused on cancer and cancer equity, cancer inequity. I've also worked on mental health as an outcome and cardiovascular disease, mostly when it's connected to cancer, sort of cardio-oncology sort of thing. We have an AHA grant right now looking at cardio-oncology disparities. In cancer itself, most of my work, at least domestically, has been on breast cancer, but I'm interested in the social determinants of health and all of the effects that can come from that. In my global health work, I work more on cervical cancer. So I won't present a lot of that today, but that is a major interest area for me. I'm also interested in environmental exposures. So as she mentioned, I have a PhD in geography. I care a lot about the predictor and also the outcome, but the predictor is really what guides me. And so environmental exposures that I'm most focused on, green space and nature, tree canopy, things like that. I'm on the Wisconsin Urban Forestry Council. That's probably not common for a public health person. I'm very interested in climate resilience and sort of neighborhood-based or community-based strategies to adapt and build resilience for climate change, things like urban heat, flooding, et cetera. Environmental justice, which I know is a taboo word now, but I've got it on my slide. I'm very passionate about environmental justice. And then also some work more recently in air quality and air pollution monitoring. There have been some great developments in low-cost air quality sensors, and communities are starting to use those to get better spatially distinguished patterns of air quality. And so I'm working with some community groups in Milwaukee on that. In terms of neighborhoods, I'm also really interested in neighborhood segregation and housing, and also in the intersection between that and the environment. But within that bucket, I would say the main thing that we've been focused on is redlining. I think most people know that as a word that describes a historical practice from the early 1900s in the United States. We've been trying to modernize that idea to look more at contemporary mortgage disinvestment patterns and the continuing disinvestments that we're seeing in communities that also were historically redlined. Also segregation, which is the outcome of these redlining practices, racial segregation, socioeconomic segregation, neighborhood quality, which is where it sort of links in more to the green space stuff. And then I'm getting more and more interested and more engaged in more housing policy, housing instability types of work, including housing related strategies that can ultimately improve public health. And then to round it out, community-based or community engaged work is a big focus area for me. So community-based innovations, I think there's a lot of work going on outside of the research realm with communities solving problems. And if they're not partnered with research institutions, we may never know what the real impacts of those things are. We may never be able to hone those innovations and disseminate them more broadly. So I'm interested in working with community groups who are doing innovative things to try to quantify what they're doing and maximize the benefit. So greening programs is part of that. I'll talk very briefly about our schoolyard greening project in Milwaukee. Really interested right now in land trusts. I'm not sure if people know what those are. I'll describe that briefly. But community land trust, which is a housing policy implication. Also programs that the community partners are running. And as I mentioned, the air monitoring and other policies. So the way that this sort of shakes out in practice, I would say in terms of methods, you can see there on your left. Community engagement. I know it's not really a method, but it's an approach, right? But community engagement is a big feature of the work I do. Mixed methods, definitely quantitative and qualitative, as well as GIS. Social spatial epidemiology may be a word that connects well to some of you in the room. Geography and spatial analysis. I do a lot of work with GIS, spatial analysis, spatial statistics. And then creating measures, like measuring the things that we're interested in studying that maybe we don't have a measure for already, and doing that often at small geographic area levels. And then on the right-hand side, who am I working with? U.S. national cohorts. Some of the measures that were created by our group have now been linked to major U.S. cohorts that are enabling us to study a wide range of health outcomes with these new measures. Midwestern U.S. I've talked to a few people today already about how important the Midwest is to me. I'm from the Midwest, and I think we're a flyover zone sometimes for the emphasis in research funding, and I would really like to see there be more work in the Midwest. I grew up in Illinois, not far from here, so I'm familiar with St. Louis. I'm in Milwaukee right now, and I've been there since 2009. Lots of similarities between those cities, as well as Detroit, Cleveland, some others like that. And then I do also work globally in East Africa. I won't talk very much about that today. Populations of interest, women, children, anyone who is minoritized or marginalized in any way. Those are the focus areas for my work. So to give you an overview of what I'll talk about, I'm going to talk about the geography of health disparity, and I'm going to use breast cancer in particular as an example of this, and cancer more broadly. I'm going to talk about our geometrics work on structural racism, primarily our contemporary redlining work, talking about linkages between these measures and health outcomes with a focus on cancer and mental health. And then I'll just at the end give you a few examples of some of the community-based strategies, and then maybe some of the future directions in some of the other work. Is anybody having trouble hearing me online, or am I projecting? Am I okay? All right. Yeah, perfect. All right, so the geography of health disparity. How many cancer researchers in the room? We have a few. Yeah. So breast cancer is one of my main areas of research. And in breast cancer, we see this pretty stark pattern of disparity where for a long time, breast cancer incidence was kind of a reverse disparity. We saw more incidence in white women than we did in Black women. That is now converged. You can see the green and the blue line converging. We're seeing really very similar rates of incidence now for Black and white populations, which is sort of momentous in breast cancer to see that happen. But the more concerning thing, I think, for a lot of us is this enormous gap between Black women and white women, in particular on survival and mortality. So we see that after diagnosis, the gap between Black and white populations is pretty huge. And that started back in the 80s or even a little bit earlier, where we were seeing new treatments come into the market. And then the haves got the treatments and the have-nots did not. but that hasn't closed. The gap hasn't closed. And even when we control for things like insurance and some of the other things, we're not seeing the gap all the way disappear. There is still a racial gap there. But what's most interesting for me as a geographer is that the gap is not the same size everywhere. Right? So we have managed to close the gap in some places. We have not managed to in other places. So this is the geographic variation by state for the size of the breast cancer mortality gap. Unfortunately for me, this is Wisconsin, and unfortunately for you, this is Missouri. Not something we want to be the top of the list at. So what's going on, right, in places like yours and mine, where we're seeing this really big gap, and places like Massachusetts, maybe we're not. And there are lots of answers to that question. But one of the things that I'm wondering is whether or not structural racism could be a big answer to that question. So why does the size of the racial disparity vary across places? And does this variation shed light on the origin of the disparity? Like, where are we seeing things big and small? Are there modifiable aspects of the environment that we can target to do something about this? What can we learn from Massachusetts, right, or other places where the gap is small, to apply in places where the gap is big? And so just to give you a sense of the community that I'm working with, when I moved to Wisconsin in 2009, I moved there from Iowa, and I made a map, and I was like, what the heck is going on here? Because I had never seen a pattern of racial segregation that looks quite as stark as this. And when we measure racial segregation at a national level, Milwaukee is always at the top of the list, 1, 2, or 3. You can see on this map on the left-hand side, our Black population is represented by the red dots, our Hispanic by the blue dots, and the non-Hispanic white by the gray dots. This is also important because we have a hyper-segregated Hispanic community, and that is not something that you see everywhere in the country. So real big problem, right? Segregation, it's a hallmark of structural racism. And it has socioeconomic consequences. And you can see those here on the right-hand side. So the employment rate for Black population is 58, and for white is 88%, right? Huge gap, 30% difference. I'm going to guess that it's not much different here in St. Louis. Poverty rate, big gap, 39% compared to 8, right? And you can go through the rest of these. But the one that gets me, I think, the most is the average poverty rate of school attended by a student who is Black is 78%, compared to white is 24%. So the Milwaukee Public School District is one of my major partners in the work that I do there. And a number of years ago, they gave up doing free and reduced lunch because it was taking much more money to do the administrative work to figure out who needed it than to just feed everybody. So now everybody just gets free and reduced lunch. So I'm not sure if you guys have had a similar situation here, but it was also like a main source of food security during the pandemic, right? We couldn't all the way close the schools because the schools were the food source for a huge number of children. So what is the health impact of this? Going back to that cancer focus and breast cancer specifically, you can see that the segregation pattern and the pattern of cancer mortality are very, very close, right? Particularly on the north side, among our Black population, we see higher rates of breast cancer mortality. Okay, well, we also see that for colorectal cancer, right? These are different diseases, right? Any cancer researcher will tell you cancer isn't a disease, it's many diseases, right? Colorectal cancer, lung cancer, liver cancer, pancreatic cancer, multiple myeloma, prostate cancer, right? So there's something here that isn't biological that's also going on. Social determinants of health are at work here. Race is definitely at work here. And if you do a statistical model on this, you're definitely going to find an association, right? Or anybody who's looking at that, yes, there's a correlation, right, between the segregated areas and the rates of cancer. So when you go to the literature, is that what you find? And interestingly, no, not necessarily. Looking at the segregation and health literature, there's a lot of mixed findings. And it seems so unintuitive that would be the case, right? There are mixed findings. Some studies have found that segregation is associated with poor health outcomes, but some have found no association. And some studies, particularly when they use those local segregation metrics, have actually found opposite outcomes. So it sort of begs the question, what's going on here? We know that these things are correlated, right? But what's happening that we wouldn't see when we control for all these other things and whatnot? We're not seeing that very consistent pattern across studies. And there are some reasons for it. Measures of segregation have been mostly focused on the metro area. There have been fewer that focus on the neighborhood. And so those have implications, for the findings that we have. Little work has compared measures of segregation. Most people kind of just choose their favorite and use it when there are lots of different ways of measuring segregation. And then I think most importantly, number 3, segregation metrics characterize the spatial distribution of people, right? It's a segregation metric says how many people of this race or ethnicity are living in this area compared to that area, or in this area compared to at the MSA or the metro area as a whole, right? They're talking about where people live, but not how they got there, right? And where we live is a matter of our constraints, absolutely, like where we can afford to live, but it's also a matter of our choices, right? So really what we're seeing, in some cases, it could be ethnic density on purpose. In some cases, it's ethnic density because we had to, right? And we can't disentangle that just with measures of segregation because it's just a measure of where people live. So we were starting to ask, okay, what can we do to do better at this? And so we moved into this area of creating measures of segregation and structural racism. How many people are familiar with these? The Holk maps? A few people? So I'll do a quick rundown on that. When you say redlining, people think about historic redlining. And these are maps that have sort of made popular or made widespread knowledge of the idea of historical redlining. So under Franklin Delano Roosevelt's administration, way back in the day, there was something called the Homeowners Loan Corporation that was created. And this corporation was created to try to go out after the Great Depression and figure out, okay, where can we, rescue people? Where can we lend money? What can we do to come back from the depression in the housing market? And so they sent these assessors out to the cities across the country, 210, I think, cities, and they made these maps. And so this is the one for St. Louis and East St. Louis on the Illinois side. And where you're seeing the red areas, those were labeled as hazardous for investment. Yellow areas were declining. And then the blue and green were areas where they're saying these are good places to invest, right? And so this is just a description. These maps come with descriptions. You can go on now to mapping inequality, and you can get the GIS files for these areas, and then you can also get the area descriptions. And this is only a few years back that these were all digitized, so they've become very popular in the literature, including now the public health and medical literature, to look at historic redlining and the impact on health outcomes. And what you find in basically all studies is a very perfect gradient between these HOLC grades and the health outcome that you're looking at. So this might be one way, that we can go forward and do better measures of segregation, right? Or better measures of structural racism, because this is definitely something that was done on purpose. It was something that was done not supporting anyone's choice, but certainly to constrain choices. And so this is something that we can certainly use. The problems, though, with these maps and these data are that there were many things that happened before Holk and many things that happened after. For example, Holk was happening and characterizing in these maps what had already occurred, right? The segregation was already there, but the segregation came from behaviors post-Civil War, that were essentially the redlining. The Federal Housing Administration and various other entities were involved in creating these patterns that then Holk was sort of encapsulating. So they're not causal as much as they might be effect. And unfortunately, it wasn't unfortunate back then, but back then cities were smaller, right? These maps covered the area of cities back in the 1930s, but no longer do they do that, right? Now we have suburbs and our cities have sprawled out behind those or beyond those boundaries. So if you use these maps, you're sort of truncating the population that you're studying. So you're missing all of the suburban and other areas of the cities and states. And then finally, we're not actually sure how influential these maps were. They were sort of squirreled away somewhere and nobody knows if anybody was using them. And we do know that the FHA had their own maps, which were apparently shredded or burned or something, hidden away, right? And those maps were actively used for mortgage investing. And the HOLC itself actually lent a lot of money in red areas. So it's very interesting to sort of unpack the history here. There are some great scholars, including a collaborator of mine, Waverly Duck. He's in California, who's doing a lot of archival historical research to try to figure out exactly what happened. Hopefully we'll know more soon. But we don't know how widely distributed they were. We don't know how actively they were used to actually guide where money went. So what we've tried to do is to build on this idea to measure where money is actively going now. So if you're familiar with it all with housing laws and things that happened throughout the century, essentially the big one was the Fair Housing Act in 1968, and that said things must be fair, right? And then of course we failed at making them fair, so they created something called the Home Mortgage Disclosure Act, which is basically a really boring law about data, which I don't know, I love data, I'm sure many of you do too. But essentially it's saying we need to make it transparent where this money is going, right? We need to collect data on these mortgages and who they're being lent to. That was created in 1975. It also had some updates that ended up adding variables. Importantly, race and ethnicity were added a little bit later on in 1989. But what we've done is to go into this database and use this information to figure out, okay, what areas are currently being disinvested in compared to other areas in the metropolitan region. And the good thing about this is that this is every census tract in the United States. So we don't have any issues with it being only, a certain part of the cities. And it's every year they collect this data. And now they have all these variables that you can use, including race, ethnicity, and income of the applicant, and loan purpose and amount. So we use these to essentially create new measures of contemporary redlining, using something called adaptive spatial filtering, which we've done a lot of work in. The cancer maps I showed you were done using that method. It's a spatial analysis method that basically uses a filter that expands to pull in enough data so that it can calculate a stable rate. So we used that filtering and then used an odds ratio within each filter, or centering on the filter and comparing to the MSA. So I'll show you a little description and then I'll show you some maps. So the first measure, which I think is the one that's probably the most important and that has found the most traction, is contemporary redlining. And essentially, this is the odds ratio of being denied a mortgage application if you apply to live in this neighborhood, this local place, as compared to anywhere else in the metropolitan area. Okay, so it's a measure of disinvestment. Nothing to do objectively with race and ethnicity, although of course it has a lot to do with race and ethnicity. It's just that it doesn't incorporate that into the statistic. It's just a matter of this place versus the rest of the MSA. We also created measures of racial bias and ethnic bias in mortgage lending. And so this is a little bit different. This says within this particular local area, what is the odds of being denied a mortgage application if you are Black compared to white as the primary applicant on that loan application? And then the second one, of course, ethnic bias, is Hispanic compared to non-Hispanic white. Any racial comparison could be done here, provided there's enough data on those racial and ethnic groups in the data set to make the comparison. So if you can remember the map of Milwaukee that I showed you, these are the three measures. So this one is racial bias in mortgage lending. So this is the odds ratio of denial. That's all right. The odds ratio of denial of a mortgage application if you are Black compared to white. And so we're seeing on the north side of Milwaukee, in the area that is primarily inhabited by Black people, that odds ratio is pretty low. So the racial bias against a Black applicant is low. But if a Black applicant tries to apply for a loan out in the suburbs, it's red. Right? So I like to call that the push effect, right? So if we're trying to desegregate, that means somebody has to move, right? Somebody has to move from one place to another. But when we try to move, we get pushed back. Same sort of thing we see for ethnic bias. If a Hispanic person tries to apply outside of the Hispanic area, they get pushed back. That's the red spots, which looks very different from redlining, which is this one. And this one is maybe more correlated with what you saw on those segregation maps, right? We're seeing that there's major disinvestment in mortgage lending in the areas currently inhabited by people of color. Again, no race or ethnicity information was incorporated in this statistic. This is all just based on where the dollars are going and controlling for the loan amount and the income of the applicant. So all other things being equal, there should be no map, right? But if you map anything, there's a map, let me tell you. So has anything changed? Well, I'm sorry to say. Just to illustrate, this is Milwaukee. In the 1930s, that's our Hulk map. You can see the red and yellow areas on the north side and on the south side. The blue and green are in Shorewood, up on the lake, and then also Wauwatosa, which is a near west suburb of Milwaukee. And we're seeing, again, those hotspots of disinvestment of dollars right now, not based on race and ethnicity, disinvestment in those neighborhoods. And you can even see there's a little red spot up on the northwest part, and that even little red spot is mirrored in this data now. So there's just really strong influence of what happened so far along ago on what is happening now with these dollars. And of course, if you disinvest in a place, it's going to fall into disrepair, and then you're more likely to disinvest in it again, right? So something has to be actively done to reinvest in communities. And then, of course, to do that without displacing people or gentrifying the areas beyond repair. And just for the statisticians among us, this is the gradient in terms of what it looks like. The whole grade is on the bottom, on the horizontal axis. And then you see racial bias on the left, ethnic bias in the middle, and location bias or redlining on the right-hand side. Very clear gradients across the country. This is all the 210 cities. And the gradient goes, of course, the opposite way for redlining, as we saw in the maps. All right, so now we have some measures. Let's link it to health outcomes and see what the findings are. One of the first studies we did with this was to use the racial bias measure, but to do it at the MSA level. So we said for every MSA in the country, what is the odds ratio of being denied a mortgage application if you're Black compared to white? And we made that calculation, and then we mapped it. And what you can see here is the cancer mortality, all cancer mortality rate ratio between Black and white on the left-hand side, and then the racial bias in mortgage lending on the right-hand side. It's hard to see differences between these maps when first glancing at them. And just to emphasize the situation that we find ourselves in, this is me, and this is you. We've got a problem. And you can see in the upper Midwest, and to some degree in the Northeast, we see this concentration of the red areas for both the gap in the mortality rate ratio for Black to white, as well as this gap in mortgage lending for Black to white. And then we also just compared this to some of the other measures that are commonly used. There's something called the dissimilarity index, which is a segregation measure, also the isolation index, which is a segregation measure. We looked at all of those with mortality rate ratio and then compared it to the racial bias index. And what we found is that the racial bias index had higher correlations and more significant correlations than these other segregation metrics had in terms of predicting the mortality rate ratio gap. Right? So maybe we're improving on something there in terms of like going from the spatial distribution of people to something that is active discrimination or active disinvestment, on the other hand. We've also taken this to the individual level. We looked at contemporary redlining and breast cancer survival. This is a JCO publication from a few years ago. Our major finding was that as redlining increased, women experienced poor survival. Unsurprising, I would say, the hazard ratio being 1.39. This was among women with no comorbidities in this particular finding. We also looked at the Hulk maps with the same cohort, found a very similar situation where historical redlining is statistically significant in predicting poor survival. The hazard ratios are a little bit lower for that. I had a medical student who went through and looked at redlining predicting late-stage diagnosis, found a very similar finding there. I had a resident who looked at redlining and local regional treatment for breast cancer. So unpacking this a little bit more, looking at the causal pathway a little bit. Is stage the culprit? Is treatment the culprit? Also found a very similar finding, where people living in more redlined areas were less likely to receive the right guideline compliant treatment. We've also been recently collaborating with a fellow at the NCI, Wayne Lawrence, and he has looked now at prostate cancer survival, found a very similar pattern. Hazard ratio, similar sort of range, 1.21, 1.25. And then I have a colleague in Michigan, Michigan State University. She and I talk about these issues a lot. She's close to Detroit. And we looked in her study, which was a study of Black populations surrounding some parks that are being converted in Detroit, called the STAND study. And we did some path models, essentially. And this is where it gets a little more interesting. We looked at mental health, as you can see in those models, redlining to discrimination to anxiety, and redlining to aesthetics and life satisfaction. So very interesting findings where we're finding that neighborhood aesthetics were found in neighborhoods with lower redlining, right? That makes sense. And that in those neighborhoods, people had higher life satisfaction. Kind of makes sense. But interestingly, for anxiety, we found that people in redlined areas had lower experiences of discrimination. And then if they had discrimination, higher anxiety. If you think about that, it makes sense, right? Why would that be, right? If you're in a disinvested neighborhood, why would you have lower experiences of discrimination? Well, I think that the answer might be as simple as it's a disinvested neighborhood because people of color live there. And if you're a person of color, you may be more likely not to discriminate against other people of color, right? So people in those areas are not experiencing as much discrimination. We have more work to do to figure that out, right? So interesting. This might shed some light on why some of those segregation and health findings might not show exactly what we would expect. We've also taken this to start to look at predictors. This is a former postdoc, Dr. Namin, who looked at green space, tree canopy, and airborne carcinogens. Basically found a really nice gradient of effect there, looking at high redlining areas having fewer trees, right? Well, to some degree, that's not surprising, right? But we controlled for population density, right? We controlled for the things that we thought could maybe explain that, and we still find that gradient. And what that has to say for us is that places that have been historically disinvested are going to have probably poorer air quality. They're going to have more benefits, less benefits from trees in terms of mitigating flooding and heat, islands, and various other things in the climates. So this is sort of a sampling of the things that we've been working on to sort of look at the impact of these measures. We've also put the measures online, at least for a certain time period. So if anybody wants to use them, there are measures at the tract level and at the MSA level that people can download. That's how Wayne Lawrence and I got in touch. Please use them and find more connections. So where do we go from here? I think one of the things that has happened is that, interestingly, this work in structural racism coincided. We were already doing it, but it coincided with the rest of the world waking up after the murder of George Floyd and COVID-19 and the pandemic and all of the marches of Black Lives Matter. And a lot of people woke up and got interested in this area. And so we've had a lot of interest from other people across the country in using these measures. So this is a list of our collaborators. Some of these are NIH-funded partnerships. We're holding our breath to see what happens, but others of these are just papers, and major cohort studies is the main thrust here. So connecting it to the CARDIA study, to the MEC study, to the American Cancer Society CPS-3 study, to the Southern Community Cohort study. And there's a Hispanic-focused study also now at Einstein that we're trying to connect to. And St. Jude got a good score on a grant, so we might do that. And then I definitely will need the umbrella. But this is what we're trying to do, is really spread the measures out there, have people use them, see what else you can find. Because like I said, the predictor to me is more important than the outcome. I think there's all sorts of things that we could find with this. And then mediation, right? Mediation. What are the mediators of that? How does it behave? But we didn't stop there. We wanted to do more work in this geometric space. And as I mentioned, a lot of my interest is in environment. So we're trying right now to build what we're calling an environmental racism index. So this is essentially mortgage disinvestment index, which is the redlining measure, except we've now extended it to suburban and rural areas, whereas before it was just for MSAs, because the historical concept of redlining is really an urban phenomenon, right? But we wanted to look now more at just disinvestment in different neighborhoods. And so we've expanded that idea, and we're calling it the Mortgage Disinvestment Index. So we're looking at that, and then modifying some of the calculations that we're doing. There's all sorts of things you could do: primary applicant versus co-applicant, looking at gender, looking at different racial to ethnic comparisons. And for some of the partners that we're working with, we've also gone back to the historical data. So we're trying to dig around and find shape files for 1990, which is not always easy to do. But that kind of thing, right? Going back and seeing what we can figure out from the history there. And then finally, the Environmental Racism Index. And in this, we're taking the Mortgage Disinvestment Index, so this contemporary redlining idea. We're looking at the three-way correlation between that, environmental exposure, and the proportion of individuals in a tract who are not non-Hispanic white. And what we've done so far is to map that. And unfortunately, you guys, that's me, and that's you. We have a problem, right? We haven't validated this yet. It's still in the works, but what can we learn from this, right? That close tie between disinvestment dollars, who lives in this neighborhood, and then what the environmental exposures are. I'm also doing quite a bit of work now in climate change. We have a study where we're looking at the contemporary redlining measure and urban heat in particular. And then we have, again, holding my breath, we have a climate center grant. UW-Madison is the primary, and I'm the lead of the Community Engagement Corps, which is hosted at MCW in Milwaukee. And we're doing quite a bit of work there with community partners to build on some of this. So hopefully that will stay. Also related to the climate stuff, as I mentioned, community-based innovations. There's this great nonprofit organization called Reflow in Milwaukee, who's partnered with Milwaukee Public Schools to transform these asphalt schoolyards, which was basically all of them, into green play yards. And it's not just a pretty place to play, it's also a cistern, a bioswale, permeable pavement, et cetera. So trying to understand what the impacts of these transformations are on the kids. We're right here in our collection. Again, holding my breath, there was a news article about canceling all EPA research, and this is EPA research. But we're doing all sorts of things with data collection there. So we have the kids wearing belts. They love this. They can't even see what they're doing. Like, there's no step counter that's visible or anything like that, but they love the belts. They have a GPS device and an accelerometer, so they run around and do their thing, and then we can see where on the schoolyard are they playing, how much physical activity are they getting in different areas on the schoolyard. We're also giving them surveys, social emotional health, various other things. We also go out on the schoolyard with fun gadgets. I'll save the best for last. At the bottom, we have a solar heat gun, also a Kestrel, a weather monitoring device. The funny little white ghost looking thing is an AirBeam 3, which is an air quality monitor for PM 2.5, PM 10. This is medical student here doing recess observations, looking very serious. She was uncomfortable with this photo. And then the fun thing up at the top left is a cool remote control car that NASA built called a Terra Rover. And this is improving on our heat collection because other than like zapping the ground, and we're using aerial photography and stuff like that too, but to get under tree canopy and things like that, you need something where you're physically collecting the measurement. So this is a remote control car that our staff drives around, and it has a solar monitor on it and a GPS and everything like that. So of course, sharing research results with the kids is pretty fun because they get to play with the tools. So that's research underway. We're collecting our last batch of data right now, and then we'll be doing a whole lot of data processing and analysis, because as you can imagine, it's a lot of information. As I mentioned, I'm also very interested in this housing space and getting more into this in terms of community-based interventions. So we have a pilot grant just funded locally on community land trusts. There's very little research on community land trusts and public health. I think there should be more. Essentially, community land trusts are ways to boost home ownership among low-income buyers, and also could be used as stabilization in potentially gentrifying areas. So a community, however that's defined, buys a parcel of land with a house on it and maintains ownership of the land, so the land can never leave the trust, but then they sell the house. Okay, so then the house is cheaper because it doesn't have the land cost and because the CLT can manage the cost. Somebody buys the house, they have rules and regulations about how high the cost of the resale could go. So it limits the amount of home equity, it limits the amount of money you have at the end, but it keeps that in low-income hands in perpetuity. It does allow people to be first-time home buyers, and it can stabilize neighborhoods by keeping those low-income parcels in low-income hands. So we're just doing some basic work to talk to people, do some qualitative interviewing, and figure out what is going on right now, in this space. Ultimately, there are CLTs is like an old invention, but more recently has just surged like crazy. So there's a bunch of stuff going on now. So I'm interested in more broader examinations of this. I'm not sure if St. Louis has a land trust. I haven't looked that up. But I think it's a really innovative way going forward for us to deal with some of these problems that we've been talking about. So I just have a few acknowledgements I wanted to share. I can't talk about everybody who's ever participated because there's too many people. So I'll just highlight my team right now, which is the group here with the pictures. Courtney, up at the top, is the one who makes everything go. She's the manager. Without her, there's nothing. Dr. Jo Yu-Hung has been with me for 15 years. She's a research scientist, does a lot of geospatial work, and is the engine behind the contemporary redlining metrics. Elizabeth has joined as a program coordinator, and then you can see a few of the faculty and other students. Bottom row is all students, and Elena is also a medical student. She's on the top row. But they've contributed quite a lot to all of this work. I've talked with so many people already today about mentorship, and I love mentorship. And I think learning by doing is a great way to get into it. A number of the partners that we work with down there on the bottom, and then funding, some of the funders on the bottom right. Okay, that's all I have. And this is the QR code for the measures, if anybody is interested in downloading them. Thank you.
Thank you. That was a great presentation. I meant to mention this earlier when we met, but I teach a course in environmental racism, and we discuss a lot of the issues that you have brought up here. I'm wondering, with your environmental racism index, you talk about mortgage disinvestment, but what about that kind of a related issue of green gentrification and people being displaced because of, we want to do something good, but we have unintended consequences with green gentrification, right? Atlanta Beltline being a great example of that, where people are really displaced because of high rents or increased property taxes, and it's hard to buy more, get a mortgage in a place like that. So is that part of what your environmental racism index?
So it's not part of the environmental racism index, which I would say is more like a snapshot in time of, what are the current dollars being invested or disinvested? What is the current environmental exposure? And we do have green space as part of that. So that's part of it. There are 5 dimensions right now, and we're playing with them a little bit. But there's also like an air pollution dimension where you could just calculate the index just for air pollution, right? But I think you're totally right. And this is the struggle that I and everybody else in this field has faced forever and will continue to face. And that's why I love the CLT idea. because we need things like that are creative ways to fool the market, so to speak, or to force the market not to do what it wants to do. But I think you're absolutely right. Green gentrification is a problem. I'm a little worried that we're giving the greening part a bad name by talking about that, because there's so many other forms of gentrification, right? And I think we need to hold all of them to the same standard, and talk about making places better places to live without displacing the people that you're trying to help, right? Or that you're trying to expose to something better than what they're being exposed to. Yeah, perpetual problem. Yeah.
Thank you for that. I learned a lot about history of this. I wondered if you could speak a little bit about what you see as the biggest connection between the housing policies and health, and what kinds of things you might do to improve that situation. The policy decision, is it a housing loan decision, or what's the bigger area to?
I think there are so many different dimensions of housing, and I feel like we're in our infancy really in studying housing and health, and there needs to be a lot more done there. Definitely, I think that this widespread disinvestment part is a huge implication, and that's why I started to focus on that. But I do think, eviction was written based on what's going on in Milwaukee, right? Or Evicted. You guys read Evicted? Eviction is huge, right? And all of these policies or challenges are sort of the behavior of what is going to happen unless we do something to stop, the market from doing what it needs to do. So eviction, housing instability. In MPS, in our study, we had to account in our sample size for how many kids are going to leave the school, right? It's like 30% of kids leave the school or go to another school in MPS every year. So that instability is a huge problem as well. And the one thing, the elephant in the room is rent, right? Rental properties and rentership. We have a big problem in Milwaukee with predatory landlords, so to speak, or big landlords who own many, many properties and sort of dominate the city and make it impossible for anybody to get affordable and quality housing. So I think I would need to be a lawyer or a real estate developer or some other things in order to answer all of those questions. But I think that's a great opportunity for health to get to its boundary and start talking to the housing people more.
So, like in terms of the health, you're saying that it's the stress and the environment, or is it like that people have to pay attention to all of these other environmental and discriminatory policies, and they can't take care of their health? I'm just wondering, because you mentioned the cancer things, that there was some causal potential.
Yes. Again, I think the answer is there are many, many, many ways. One is environmental exposure, right? So poor quality housing will have indoor air quality problems as well as outdoor air quality problems. It'll have safety problems. Not having stable housing or living in a region that's disinvested and therefore has crime and violence, like all of these things can cause stress. I think stress for me is probably the one that I think is the most important. But all of these places that are disinvested also don't have access to fruits and vegetables and walking paths and physical activity and nutrition infrastructure. And then it's also about access to care. Milwaukee, we have a terrible transportation problem. Our bus system is really bad. And all the jobs are in the suburbs, and all the hospitals are outside of where they need to be, and people have trouble getting there, from certain parts of the city because there just isn't a way to get there. So I think the answer is yes, yes, and yes in terms of the many ways that housing impacts health. If I had to pick one that I'm most interested in, probably stress. Yeah.
Yeah, it's related to your question, Mary. So first, thank you. It's great. I was curious about policy translation in your work, and sort of building on Mary's comment. I suppose nationally, there's probably not a lot of hope right now, and a lot of this is locally controlled anyway. Yeah. But so if you're working with a local policymaker, in Milwaukee or St. Louis, anywhere else, and they're not going to be sold on the social good of this, but other things. What are the other things, and how much of that have you done so far in your work?
Yeah, I think first I'll just add that although I believe that these maps show racial discrimination, legally speaking, you can't prove racial discrimination with these maps because you have to have information like the credit scores and the employment and all these other things that we're not able to control for. So talking to lawyers and trying to sue somebody to deal with this is more challenging than you might expect it to be. But the other things, I think healthcare costs is a huge thing. I think it's the argument for public health, that we always have, which is that prevention is cheaper than cure, and that the people who are dealing with the health impacts of these disinvestment policies are then showing up at the ER or showing up with advanced disease that is much more expensive to take care of. I think you can make a tourism argument for some of this as well, that if we allow parts of our cities to be disinvested, then we're not going to be able to attract the best and the brightest to come and work in our universities or come and work in our companies. And racial discrimination, racial segregation, racial disparities is not a good look for a city in terms of inviting others to come and join us. I think that's a problem that the Midwest has had. You can see our very stark patterns of segregation. I think it's a problem that needs more care and investment than it's gotten.
And are you working on some of that policy translation?
With partners,
yeah.
I'm doing more of the sort of community-based innovation stuff. I feel like the land trusts have a lot of traction. So trying to elevate the community partners to the best that I can there. But yeah, there's also an architecture professor that I'm working with in Milwaukee. He's got a new center which is focused on practice, trying to do something about these particular policies. But I mean, local government is relatively friendly in Milwaukee, but it's still a quagmire, just like anywhere else. So we're doing our best, but I put my energy into the community-based innovations that I think are going to be more powerful. Yeah.
Thanks. This was a really interesting talk. I have a two-part question. Oh, sorry. Did you?
I'm negotiating the next question. It appears that I don't have time. So take your time.
So you lost your opportunity.
5 minutes on this rate.
Okay. So my question is, when you look at sort of the data that's from since 1975, where you have like the more information available, are you able to see gentrification happen? And when you look, like some of the maps were not perfect, like overlaps in some of the examples you showed. And so are you able to tell in places that do versus don't gentrify, like what happened in those places, and think about like land trust is one intervention that you mentioned, but if there's other things that happen in those places that are able to put resources into communities that have been historically disinvested and actually keep a sort of more desegregated population as opposed to having a gentrified neighborhood.
So first, I would just say that the 1975 is when the law was passed, but all the records from 75 until like 90, 91 are on paper somewhere. Okay. So we can't get them. And they also don't have race and ethnicity in them the way that they would need to really get at some of this. So it's kind of the 1990s forward. We are in the process of trying to do that. It takes a lot to do historical GIS, to be honest, and to figure out which particular areas we're going to use. Tracts and MSAs and everything change over time too. But yeah, I think we could do that. And there have been some, we looked at a scatter plot, for example, some where we see like some cities like pop out as being different than others. Philadelphia is one I remember, just had a few times where it's just like, oh, what happened there? Because the disconnect is not what you would expect it to be, right? And also I would say that goes for, the racial bias in mortgage lending and then the mortality rate ratio. Like Boston has redlining, right? But it doesn't have the MRR that other places do. And it's probably because of universal health care in Massachusetts prior to the CARE Act, but that's just a hypothesis, right? So there are some places that have disconnected this investment from health, and that's one solution, right? The other solution, of course, is to desegregate or reinvest without gentrifying and kicking people out. Yeah.
Thanks.
Great talk. Thank you so much. Oh, well, you're talking like, well, he's not going to take up your time.